what does health equity look like when we're looking at the state of Washington? And the state of Washington is very diverse. We've got Western Washington that's much more urban and more high population. You got Eastern Washington that's got a lot of rural settings and very long distances to get care. And so you're going to see differences in sort of that health equity depending on where you're really looking. Eastern Washington are going to be issues of distance and where is a provider and how do I get to a provider. And in some parts of Western Washington, it's really going to be income related and do I even have transportation to get someplace? So the answer isn't always the same. It will depend on a little bit about where you live, what part of the state you live. But what we do see in our data for the Washington Health Alliance is that equity is a big issue. Where you live matters, and it can severely impact whether you're getting the care that you need and the care that you should be getting. And so if you're in a more risky area, your risk of not getting care appropriately is much higher than those in a more privileged area. And so we need to bring all people up to the highest level possible so that people can live their healthiest lives. So when we think about equity, we think about equity in the workforce, sort of equality type issues. But when we think about health equity is a little bit different and sometimes a little bit harder to see. Health equity affects the entire workforce, and it can affect people, from different parts of life as well. The employer should really start paying attention to that. Why? As an employer, you want your population healthy, showing up for work, being productive. That's really important. You want their families to also be healthy so that they're not thinking about them while they're at work. And addressing equity concerns, whether that be getting transportation, getting into a primary care office, taking their meds because they can afford them, making sure you have a benefit design that is not going to be a barrier for people accessing care. All those things are really important because it helps you as a business to be able to run your business more efficiently as well. So the Washington Health Alliance runs a website called the Washington Community Checkup. We have been producing data since 2008 across both Western Washington and more recently since 2014 across the entire state. It shows quality measures. It shows quality measures by county, by accountable communities of health, by medical group, and even by medical clinic if we have enough volume. So you can go in and you can look up whatever is important to you. If you're a diabetic, you might say, I want to go to the clinic that has the best, scores on these areas, and you can find that clinic. Or maybe I really care about the medical group. So what group in my area tends to have the higher scores for the things that matter to me, right? Hypertension might be more important to me than, maternity care. So I'm going to look for certain things that are going to be most impactful for me, and then you can help choose that. Municipalities and employers can also do the same thing when they're looking at, do I have the right practices in my network? And if not, how do they work with those practices to get better? Because no practice, all of us went to med school, we all got A's to get there. We all want to get A's again. No one wants to get a B. And so we're all going to work really positively and hard to try to get, if we see scores that are lower, to get our scores up high.